Joining me here in the studio to discuss the growing trend of physician-assisted suicide and the threats it brings to human dignity is the president of Aging with Dignity, Jamie Towey. Aging with Dignity is a nonprofit that defends the rights of all people as they approach the end of life. It also has an assisted suicide watch program to follow what happens when physician-assisted suicide becomes law. Jamie, thank you so much for being here and for the work of your organization.
Happy to be here.
Really appreciate it. Your organization, as I mentioned, has launched the Assisted Suicide Watch program to track these trends with assisted suicide, compiling data from 1997 onward. I was reviewing some of those findings. Let's take a look. More than 14,000 Americans have died by physician-assisted suicide since 1997, with the real numbers likely being much higher. Physician-assisted suicide deaths increased in the U.S. by nearly 1,000% between 2014 to 2024. And non-terminal conditions, including lupus, anorexia, diabetes, they all qualified people for so-called suicide-affirming care. Jamie, tell us, what was your reaction to these findings, and what do you find to be the most disturbing or surprising?
Yeah, it's a big question, and I think the first reaction is just, it's a mess. And it's not just what the data says, and I can get to that in a second, but the first takeaway for me is just, we were promised that this would be transparent. We were promised that you'd have insight into the practice, that the poor and the vulnerable would be protected, and in reality, we have very poor insights into what's happening with the data. So New Mexico and Montana, they've never submitted an annual report on assisted suicide data. Our nation's capital of Washington, D.C. hasn't submitted one in years. Washington and Hawaii are suspending some of their reporting requirements. Vermont releases their data every other year. And so you're getting very little of what's actually happening on the ground. And on top of that, you also have tremendously conflicting reporting standards across the state. So you'll have, one state will report who died from the drugs. One state will report just how many people were prescribed the drugs. So we have no insight into what's happening. But for the data that we do have, you see some very concerning things. The first of which is we were also promised that this would be safe, that this would only go for the people for whom it was intended, people with terminal illnesses, things like, stage 4 pancreatic cancer or something, and that people that had, psychiatric issues would be protected from these laws. And so every law has a requirement for psychiatric evaluations. And we have seen that only one state, one out of the 13 where this is legal, tracks psychiatric evaluations, and that's Oregon. And last year, between 400 and 500 people were prescribed these drugs in Oregon. 2 were referred for psychiatric evaluations.
Wow.
And just to put that in context, we're talking about a population of, the highest risk for suicide in America is older adult men. We're talking about people with cancer diagnoses, with some studies showing as high as 20% of people with a terminal cancer diagnosis suffer from severe depression. One of the symptoms of severe depression is suicidal ideation.
Right.
So this is a population that is very exposed to suicide, and Oregon is doing nothing to screen for that.
So vulnerable. Well, New York's physician-assisted suicide law goes into effect next week, and advocates for that law, on this note, claim it's the safest one out of the states because of the amount of safeguards they claim are in place. You say it's one of the most dangerous and radical assisted suicide bills passed. Why is that?
When the law was passed by the New York State Legislature, it was easily the most dangerous bill that has ever been written on assisted suicide. It didn't include any waiting periods out of the gate. That's typically been put in there to protect against rash decision making. None of that. And there wasn't a residential requirement. So you could come from any state in the country and get assisted suicide in New York without any waiting period. Now, the law, as it was signed by Governor Hochul, included certain stipulations for those, but I can promise you that this is just the beginning, because they're going to come back. They always do.
What do you think's behind this boom of assisted suicide laws that are happening right now?
I think it's a perfect storm, and to take a step back and put yourself in the shoes of someone who has a terminal diagnosis or who's just living in a nursing home and is aging alone. Maybe they don't have good access to pain control. They don't have good access to care. If you put yourself in those shoes, you can understand the impulse of wanting to just escape somehow. It's the same impulse that people feel for, run-of-the-mill suicide. It's the same thing. And so we have to start there. I think that's where this is coming from. Now, those desires are playing out in a culture of death. And we have organizations like Compassion and Choices, which are $20 million a year organizations, tens of millions in assets that have been behind this push in every single state where it's been legalized. And so they're moving in on the vulnerable.
Well, speaking of true compassion, Jamie, what is your message then to someone who is seriously suffering physically, emotionally, mentally, with a debilitating terminal illness, and it's just hard for them to imagine dredging through the next day. What is your message to that person who is considering assisted suicide?
I would say your life has meaning, and it's hard, and that suffering is real, and that you deserve accompaniment, you deserve to be shepherded through this, you deserve a real person, you deserve access to care. And if you're not getting those, that's an indictment on our healthcare system. And that's what we ought to fix. We shouldn't be offering the false solution of suicide. Suicide is not a real medical treatment. It is not a solution to suffering.
I have to ask, your organization, Aging with Dignity, was inspired by a saint, Mother Teresa, Saint Teresa of Calcutta. Do you mind sharing some of that backstory and how her example, her witness, stands to be a great witness for us today in this culture of death?
Sure. Well, Aging with Dignity was founded by my father, Jim Towey, in 1996, and it was informed almost entirely by his experiences working with Mother Teresa of Calcutta. For the last 12 years of her life, he was her legal counsel and her friend. And, he got to know her when he was a staffer on the Hill for Senator Mark Hatfield in Oregon, and had his world completely turned upside down by her loving example. Within a year, he had left the Hill to move just down the road here in D.C. To her Gift of Peace home, which was for men dying of AIDS. He was by the bedsides of hundreds of deaths, and he spent countless hours at her home for the dying Kaligat in Calcutta. And what Dad saw was that for Mother, dying was more than a medical moment. It was an emotional and a spiritual moment where people weren't just there to have their pain managed or their checklist of symptoms addressed. They were there they needed to be accompanied. They needed, in Mother's words, to love and to be loved. And so when Dad founded Aging with Dignity, he wanted to take Mother's example and bring that to the United States and give people the right to have that opportunity to age with dignity.
She really encountered the individual so they did not feel like a burden, which I think many of these patients we're talking about today, that's something they share. Okay, less than a minute, Jamie, with you, but I did want to give you the opportunity to talk about the 5 Wishes program, which is an advanced care planning program. Why is this important for people who are medically vulnerable to know about?
Every patient has the right to determine the kind of care that he or she wants. That's guaranteed in federal law. And so at Aging with Dignity, through our 5 Wishes program, which has been used by 44 million Americans, 40,000 organizations have used it, we are just trying to empower patients to make decisions about the kind of care that they want and to name the people that can speak for them. And I think for Catholics in particular, every Catholic wants to finish life faithfully. They want to be in a position where they can have that hopeful vision at the end of life and really live out those moments with their loved ones.
That's really well said. Jamie Towey, thank you so much again for your work and for shining a light on this issue.
Absolutely.
Appreciate it. Thank you.
Yeah.
If you are interested in learning more about the resources that Aging with Dignity has to offer, go to agingwithdignity.org. There, you can find more about both the 5 Wishes Advanced Care Planning Program and all the data from their Assisted Suicide Watch program.